So in this chapter, we're going to take a look at some of the common viruses that cause human disease that contain DNA as their main genetic material. So we're going to take a look. We've got all the DNA viruses that we're going to talk about. We have them arranged by what kind of DNA they have. So we've got a big chunk of them that have double-stranded DNA, like what we have. We have one small group that has part double-stranded DNA, part single-stranded DNA in its replication cycle. And then we have just one single tiny little group that has single-stranded DNA. So we're going to start down the left and work our way over to the right. So we're going to be starting with our double-stranded DNA, and we're going to take a look at our first group, the Poxviridae family. Now, the pox viruses, they all have an envelope on them, and everything in this family, they're going to produce big, large pustules, also called pox, spelled different. And it's where they get their names, the pox viruses, and it's those big skin pustules that leave scars. Now, they are size-wise the largest as well as the most complex animal viruses that can infect us. They're going to multiply in the cytoplasm of our cells, and they do have a very specificity for epidermal cells and subcutaneous connective tissue, which is why one of their big outward symptoms is that destruction of our skin and developing those pustules on our skin. Now, one of the strains in the pox virus family is the smallpox, and luckily for us, it is the first disease that we have been able to eliminate, like fully eliminate, because of vaccination. Now, before we eliminated, individuals picked it up either through inhalation or skin contact. So they either breathed in very close contact with someone or touching infected tissue. Only two ways to pick it up. People that ended up picking up smallpox, the infection, they usually had a really high fever of 105, 106 or more, malaise, a rash, and then there were two strains of variola major and a variola minor. The variola major was the more virulent, more likely to cause disease, more deadly. It could, with the toxins that it created, it caused toxemia, shock, blood clotting. The variola minor, less virulent, still a very deadly virus. Now, the vaccine we were able to create, they actually dip the little tiny, it is almost a forked needle, into a drop that had this particular virus in a very small dose to not cause the full-blown smallpox, and they put it in right under your skin. Now, the idea is that your body would, yes, recognize it, see it, develop antibodies against it. The interesting part about the vaccine, because they were putting a live, I know viruses aren't alive, but a live virus underneath the skin in very small quantity, you did actually develop kind of that pox or pustule right at the injection site, which left a scar. Now, the vaccine was so effective that we actually were able to stop giving vaccines. We stopped vaccinating in 1972, which means many of you listening to this right now were probably not vaccinated for smallpox, but if you ask your parents or grandparents, someone older that you know, most likely, yeah, they can show you their smallpox vaccine scar. And again, it's because they put that live vaccine in there and it created that pox, it left a scar mark. So I challenge you to find someone that still has a smallpox scar. Now, again, we've eradicated it. We haven't even seen a case since 1977 anywhere in the world, which is why vaccinate for something that's not here anymore? However, in 2002, we have started vaccinating some individuals. We've started vaccinating military, and we've started vaccinating some medical personnel. One of the main reasons for that is that this particular virus, it is very deadly and it can spread, that it could be used as an agent of bioterrorism. So because of that, we have started vaccinating military individuals. So I've had students before they're in the military that have gotten the vaccine. They've either showed me the scar or they had just gotten it while in this class that they could show that kind of pustule. So again, if you don't know an older person you want to ask about the smallpox vaccine, find someone that you might know that's in the military that may have had the smallpox vaccine. So smallpox, luckily for us, not around. Not something we have to be concerned about. But you may see the vaccine scar on individuals. However, there still are some other pox virus diseases out there. There's the mollusca pox virus, and it's the much more common pox virus. And it causes still a skin disease. It's called molluscum contagiosum, and yes, it is very contagious. It is primarily in an infection of children. Mostly, again, kids are touching everyone, everything. They're dirty. They don't wash hands as much as they should. It's transmitted by direct contact. It's transmitted by touching inanimate objects, door handles, tables, chairs, whatever. In the United States, it's most commonly shown up as an STD, and it shows up as kind of a pink, waxy macule. So these kind of raised bumps, but they're kind of a pink, shiny look to them. Now, they usually show up where you've been itching, touching, scratching, and so the top areas, usually in the genital areas and the thighs, is where you're going to have most of them come up. Now, they can go away on their own, but they can stick around for several months. They can show up on the face quite often too, so most often people are going to try to treat it. You can freeze off those macules. You can use electricity. You can cauterize it. There's chemicals to get rid of it, to speed it up. Now, there are a few other pox viruses out there, but most of them are animal pox viruses. So we've got some pox viruses. There's cowpox, rabbit pox, mouse pox, elephant pox, there's monkey pox. There's other pox viruses out there. Most affect just the animal themselves. But humans are susceptible to monkeypox and cowpox as well. So if you're in close contact with these animals, it can cause some of the skin pox, usually milder versions. It could cause fever, it could cause swollen lymph nodes. It's again, usually if you have higher contact. Edward Jenner is the one that is known for developing the first vaccine, because he realized that milkmaids that developed the cowpox, because it's still in the Poxviridae family, they actually didn't get smallpox or got a lesser degree of it. Their immune system had some recognition of a pox virus. And so he was the one that realized that they were actually getting vaccinated by having that close contact with the cows. Now, because we don't vaccinate for smallpox anymore, we seem to be seeing more cases of monkeypox. Part of it, it's, well, if we vaccinated for smallpox, just like if you were immune to smallpox by having cowpox, well, if you were immune to smallpox, then you'd be immune to these others. But we're not vaccinating anymore, so we're starting to see more cases of monkeypox. Now, that's usually more if you travel to Africa. That's where you have more of the higher cases of monkeypox if you're in close proximity to the animals themselves. However, the strains do seem to be becoming more virulent, and we have had a more recent outbreak here in the United States with people that had pet prairie dogs. There was a big group of them that had contact with an infected African rat, so the prairie dogs picked it up, and the people that had them as pets ended up picking it up. So I'm like, some pox viruses are still out there. Luckily, we don't have the very deadly smallpox. So which of the following is not caused by a pox virus? So we've talked about molluscum contagiosum, that's that pink waxy kind of papules, macules. We've talked about smallpox, we've talked about cowpox, but we haven't talked about chickenpox yet. Although chickenpox has the word pox in it, it is not in the Poxviridae group. Now, moving on to our next group. Still double-stranded DNA, but we're going to move on to the biggest family there is, and it's the herpes family, the Herpesviridae family. Now, all of the virus strains that's in the herpes virus family all show some kind of latency, meaning they can go dormant and then come back again. And the complications usually happen when they become more active, Anyone that, as they're getting older, they seem to be becoming reactive. People that have cancer treatments, it seems to reactivate them. People that are immunodeficient, it seems to reactivate them. And usually are going to suffer from the side effects depending which herpes virus you have. If you have no working immune system, if you're in the age stage of HIV, it can cause even more severe complications. Now, herpes is a very common virus. I'm just one of those that's, you probably have herpes. I'll admit, I have herpes. One of these strains. The question is, which strain? There are so many strains. There's 8 major strains of herpes viruses. Everyone, when they hear the word herpes, will always, they realize there's 8 strains. We're always going to think of the herpes 1 or 2. Always. As far as I know, I don't have herpes 1 or 2, but I got one of the other ones, or have had one of the other ones. And again, you may have 2. Most individuals, as they go throughout life, will pick up and retain one of these herpes viruses, because they are so common. Now, their structure, they have an icosahedral double-stranded DNA. They hang out inside the nucleus. That's where the DNA likes to hang out. And 2 of the more common, and the other ones are so common, are the herpes simplex virus 1 and herpes simplex virus 2. Most of the time, again, when you hear of herpes, you most likely, without realizing it, are thinking of one of these, the herpes simplex 1 or the herpes simplex 2. Now, both of them are going to cause lesions. The where is a little bit different. The human herpes virus, or herpes simplex virus 1, usually cause lesions around the mouth. Their lesions are called cold sores or fever blisters, and usually this particular virus is picked up earlier on in childhood. Herpes simplex virus 2 causes lesions on the genitalia, possibly around the mouth as well. This is usually picked up a little bit later in life, usually when you get to the sexually active age. It can also be spread without any visible lesions. Now, just a little bit about the herpes simplex virus. It is transmitted by direct exposure to any secretions that contain the virus. So if you've got an active lesion, there are secretions that are coming from there, and those secretions are going to have active virus, which means it is a site that you could be spreading this particular virus. Genital herpes, however, the human herpes simplex 2, can get transmitted without lesions, but lesions are a big active site in how it's spreading. Recurrent infections, anytime they go dormant and come back, again, fevers, UV radiation, the sunlight can sometimes trigger this virus. Stress can trigger it, any kind of injury, getting bumped, hit, bruised, can all trigger this virus to go active. Now, newly formed viruses, so these are active viruses that are spreading, these are going to be the ones that produce those local skin lesions. So the type 1 herpes simplex, found usually it's found in children and in adults. It causes what's known as the herpes labialis. That's your cold sores. It's the official term for it. But it can also cause the herpetic gingivostomatitis. This is inflammation around the mouth and the gums. And so, shown just in the picture over here on the right, the tongue can start to show inflammation. The lips, anywhere in the gum line, can show inflammation. That usually happens with the strain in younger children. It, however, can also cause what's known as the ocular herpes or herpetic keratitis. It's inflammation of the eyes. That the eyes are inflamed, it has kind of a gritty, you've got sand in your eyes feeling, you're going to have pink eye, pain, sensitivity to the light. Now the herpes simplex 2 strain is the one that's generally going to show some of the genitalia lesions. So it's usually going to start with the body's fighting off something. There's going to be tiredness, anorexia, fever. You might have swelling in the groin, painful urination, itching. Things that can reactivate it, well, stress, menstruation, any other kind of bacterial infection can all aggravate the virus to go active again. Now, herpes simplex 1 and 2 can also spread to newborns. If mom is having an active infection, especially herpes simplex virus 2, during or before the infant is born, the infant can pick up this particular virus. It can cause an extreme infection of the mouth, the skin, the eyes. It can cause damage to the central nervous system. So it is one they do a lot of preventative screening of pregnant women to find out if this particular virus is active. If it is, they might deliver by C-section if there's an outbreak at the time, just to eliminate any chance that this virus might infect the newborn. Another herpes infection that can happen, and maybe you know someone that's had this, it's called the herpetic whitlow. So both simplex 1 and simplex 2 can cause it, and it's generally any kind of dent, damage, cut, scrape, bruise to the finger aggravates this virus, and it causes an inflammation, extremely painful, itchy around that skin. Workers in the healthcare are at greatest risk of picking this up because anytime you have active lesions, you're spreading it. And that means any patient you are working with that might have an active lesion on your hand. I mean, people are shaking hands, maybe not right now, but people shake hands, they touch surfaces everywhere. And if you have an active lesion, you are actively spreading that virus. So workers in healthcare are at greatest risk of picking it up, but they're also at greatest risk of spreading it. And so a lot of times healthcare workers, if they have active infections, they've got to have those hands completely covered, their whole shift, gloves on all the time, so they're not spreading that virus. Now, diagnosing a herpes virus, they're usually going to do a scraping from an active lesion. They're going to try to look for what the virus is doing to the cells. And what the virus is doing to the cells, it is causing these cells to fuse together. So we can see multiple nuclei all together. It's like one large fused cell. They can also do some direct antibody tests, trying to look to see if you've got any kind of immune system response. Treatment, we have some antivirals. The idea for the antivirals is to try to make those lesions go away. They unfortunately do not get rid of the virus itself. They're kind of just trying to make that virus go back to being dormant, because those active infections is what's spreading the virus, and it's what we don't want to be doing. We don't want it to spread. So they're just there to try to make those lesions go away, but the virus doesn't go away. Now, the herpes simplex 1, it usually causes cold sores, and then the herpes simplex 2 usually causes more of the genital herpes. Now, our third herpes simplex virus, still in the herpes, is the herpes simplex virus 3, also known as the varicella zoster virus. This is one I have. So, yes, I have herpes. I have the herpes simplex virus 3 in my body. Now, humans are the only natural host. It's transmitted by respiratory droplets, and it's transmitted by contact with skin lesions. The first time that you pick up this virus, you develop a condition known as varicella, also known as chickenpox. And it's got characteristic vesicles. You've got a red rash, usually with a fever accompanied with it, but that usually goes away. It's usually about a week to 2 weeks after you pick it up that you start to show these symptoms. Then it goes away and it remains dormant in the body, but it's still there. The problem is it then becomes reactivated, and lots of things can reactivate it. Lots of things can reactivate herpes. Again, surgery, anything that changes your immunocompromised state, anything, x-rays, bruises, UV light can reactivate it. And that virus, when it reactivates along a nerve cord, and you develop a condition known as shingles. This then is more common in older patients because it's gone dormant, and it can remain dormant for years. It can remain dormant for decades. But then it's those years later that we pick it up and we see it reactivated. Now again, when it becomes reactivated along nerve roots. And so it will usually show a painful rash in just one part of the body. So your rash isn't just one part of the body. It's whatever part of the skin that particular nerve root controls. Sometimes you can see it as a full line. It's the skin that is controlled by a particular nerve root. Now, when they diagnose the herpes simplex virus 3, they usually just use the characteristic skin lesions. You've got an itchy red rash everywhere, and people around you also have chickenpox, and you haven't gotten vaccinated for it. Or the fact that they've got that lesion in a line in past history, you have the chickenpox, so it's in your body. Now, they can look for the multinucleated giant cells to do a confirmation. They can do fluorescent antibody tests. Treatment is just generally treating symptoms. You've got itchy red rash, well, calamine lotion. You've got the painful lesions on your skin from the shingles. Again, more calamine lotion. It's treating symptoms. Now, luckily, we do have some vaccines now. We do have a live attenuated vaccine against chickenpox. So whereas I've had chickenpox because there wasn't a vaccine back in my day, I've had chickenpox, the virus is in my body. You guys know, and I'm like, if you haven't already had it, there is a vaccine for chickenpox, so you can prevent this virus altogether. Now myself, because I know I have this virus in the body, at some point later on, I'm going to be due for another vaccine called Shingrix. It's the newest shingles vaccine that's on the market. Came out 2018. Very effective. It's really there to kind of wake your immune system up to this virus. Your body knows it's in there. However, it kind of forgets about it 10, 20, 40 or more years later. And so this vaccine is almost like a booster, so that when this virus does try to reactivate it, your immune system is right there to try to keep it at bay, so you don't develop all of the symptoms from shingles. The next of the human simplex virus 4, I haven't had this virus, but many of you may have. It's the Epstein-Barr virus. It causes mono, or infectious mononucleosis. This particular virus infects your lymphatic tissue. It also likes to hang out in your salivary glands, particularly your parotid salivary glands, and it's transmitted primarily with contact with saliva. I mean, there are cases it can get transmitted with blood transfusions or organs transplanted, but the number one way it's transmitted is through saliva. Now, high school college age population is the most vulnerable and usually the ones that are most commonly picking up this particular virus. It's nicknamed mono or the kissing disease because it is spread by kissing. But they say by midlife, 40s, 50s, about 90 to 95% of all people are infected with this virus. It means at some point, you probably are going to pick it up. Now, if you've had it or known someone that's had mono, main symptoms of infectious mononucleosis: sore throat, high fever. You're going to have your lymph nodes in your, in your armpit areas are going to swell up. You're usually going to have an inflamed spleen. The interesting part about this particular virus is that it targets your B cells. It targets your lymphatic system, your immune system, and it targets your B cells. Well, your immune system-wise, your T cells' job is to recognize virally infected cells and destroy them, which means your T cells are going to destroy your B cells. So it's a little bit of a civil war. One kind of immune system cell is attacking another kind of immune system cell. And it's that civil war that your immune system is creating that gives you the signs and symptoms of mono. Now, this virus, it can go dormant and it can become reactivated. And unfortunately, a lot of individuals are asymptomatic, which means they can be spreading it without having any knowledge that they're spreading it. Now, your immune system, because it is a civil war in your immune system is usually kind of the telltale, clue on what kind of symptoms you're going to experience from this virus. So, looking at your immune system, if you have a normal immune system, not a strong immune system, but not an immunocompromised immune system. So kids, they have a normal immune system. It's not super strong. They haven't been exposed to lots and lots of things and it's still developing. So they have a normal immune system. Most kids are asymptomatic. they can be spreading it, but most kids are asymptomatic just because they have a civil war going on, but their immune system is a pretty weak civil war to the point they don't even show the symptoms. If you have a strong immune system, you have a strong civil war, you're going to have the worst signs and symptoms of this particular battle. Now, the people that have a poor immune system, immunocompromised, can suffer from Burkitt's lymphoma, which is shown in my two pictures up here, that it is affecting the lymph nodes primarily on one side of the neck. It causes massive inflammation. It can cause nasopharyngeal cancer. It's also linked to chronic fatigue syndrome and Hodgkin's lymphoma. If you have no immune system, so those that are in the AIDS stage of HIV, it can also cause a condition known as oral hairy leukoplakia. Almost like our cancer in the mouth. Now, your tongue doesn't actually become hairy, but it almost forms these little ridges along your tongue. That's all because of different immune system and how it responds to it. Now, diagnosing it, they can do a blood smear, and it will show neutropenia. It's a lacking or a lack of neutrophils. And the lymphocytes that are present are going to be atypical. This is what a normal lymphocyte looks like. It's round, the nucleus is quite large, it even takes up the majority of it. An atypical lymphocyte, it's not really round anymore, and you're going to have a little more of that cytoplasm in there. They can also look for antibodies and antigens. Treatment is mostly, at the relief of symptoms. Get lots of sleep and rest and vitamin C. There's not a lot that they can do to speed up the treatment. Now, the herpes simplex 5 virus, it's known as the cytomegalovirus, which means a virus that makes a cell really big. And so they produce giant cells with these large cytoplasmic inclusions, which they usually come in pairs of inclusions, and they usually stain darker. So a lot of times they produce what they say is called owl's eye cells, that you have these two dark staining inclusions. Now, this particular virus is found in just about any bodily secretion that you can make. Saliva, respiratory mucus, milk, urine, semen, cervical secretions. Pretty much, if it's a fluid that can come out of your body, this is a virus that can be found in it. And so it's an extremely common virus. Luckily, most infections are asymptomatic. So you probably have it, but asymptomatic. The groups that are usually going to have a more virulent form of the virus: fetuses, newborns, and immunodeficient adults. And so newborns, they might exhibit an enlarged liver or spleen, jaundice, bleeding, microcephaly, inflammation around the eyes, might be fatal. Those that survive might still have neurological complications or hearing or visual disturbances. Sometimes they can just cause really rare disorders that by the time the doctor, if there's a patient that comes in and exhibiting all these signs and symptoms, they've run through every single test out there and everything came back negative, then they might just start to look at this one, because sometimes it does cause different neurological symptoms. Now, treatment, we do have a couple antivirals usually given to those that are immunocompromised. Again, there's usually not a lot we can do for newborns after they've picked it up already, and everything else is mostly asymptomatic. So usually the treatment, those antivirals, is just for immunocompromised patients. Now, our last herpes simplex viruses, 6, 7, and 8. I'm going to talk about 6, and then briefly 7, and then briefly 8. Now, the human herpes virus 6, or herpes simplex virus, it's got two names. This is transmitted by saliva, being in close contact with each other, and it is a common virus, but it's usually picked up in infants. And it causes a condition known as roseola. So usually babies in their first year are going to develop a very faint pink rash. The rose comes from that pink color of their rash. So they just end up with a rash on their body. That's usually it. Generally goes away, nothing too more. They might obviously have signs and symptoms that they're fighting something, a slight fever. They might be irritable, but it generally goes away without any serious complications. Adults, if they get it, usually have some more mono-like symptoms. They might have inflammation of the lymph nodes, tired, fatigue, fever. The interesting part is that about over 70% of multiple sclerosis patients show signs of infection with this particular virus. They seem to be at a higher risk of this particular virus. Now, not sure if it's because of certain cells that it's infecting. I mean, it does get into the salivary gland, and because it's spread with saliva, but it gets into some of our other immune system cells as well. Now, they have shown some clinical studies that there's a relationship with the human herpes virus 6 and Hodgkin's lymphoma, some oral carcinoma, and certain T-cell leukemias. Again, it can affect some of these other cells. Rare, and they're still looking to see how and why that might be happening. Now, the human herpes virus 7, it is very closely related to human herpes virus 6, so it causes very similar type of diseases, that rash, the fever, mono-type symptoms, and I'm like, and that's about it. So it's just, okay, we talk about human herpes virus 6, causes the roseola, the mono in adults, but the human herpes 7, similar type symptoms. The human herpes virus 8 generally only causes issues for adults that have no working immune system, so those that are in the AIDS stage of HIV. And it can cause a cancer known as Kaposi's sarcoma. Now, this is a cancer of blood vessels, so it causes the blood vessels to enlarge. And so we have blood vessels very close to the surface of our skin in our mouth, so we can see these blood vessels enlarging. We can see them enlarging and almost popping right underneath the skin. So this is a virus, the human herpes virus 8, and it only affects those that have no working immune system that are in the AIDS stage. Now, varicella and the herpes zoster virus, they are the same virus. Is just varicella is the first time you get it, is the chicken pox, and the herpes zoster is what we call the shingles. Now, moving on to our next DNA double-stranded group, and we're going to move on to, it's the Papillomaviridae group. Now, it's in this group we have what we call as papilloma and polyoma viruses. So they're small, they're non-enveloped, they're the double-stranded DNA. Their DNA is circular in shape, and they usually cause persistent infections, ones that take a long time to go away, as well as developing some tumors. Now, the human papilloma virus causes papillomas, which is the official word for a wart. It's squamous epithelial growth. It's that epithelial tissue is growing in one small area, and you now have a growth called a wart. There are, however, over 100 different strains of human papillomavirus. They're usually transmitted by direct contact, so touching that wart to either more on your skin, you can spread it on yourself, as well as touching that infected skin onto someone else, or contaminated objects. So touching door handles, chairs, whatever. Sharing shoes is a very common way that people pick up this particular virus. Now, incubation, it could take 2 weeks or more than a year before you even show the wart. Now, what's nice is most warts do eventually go away. However, to speed it up, you can chemically remove them, you can burn them off, freeze them off, and you can even laser surgery them off. Problem is, once you have it, it usually means that you're more likely to have another wart show up. Now, depending on where they show up, kind of depends on what we call them. A common seed wart is, it's common. They're little painless elevated growths, usually on your hands, on your fingers. So if all of a sudden it happens that you might just get a little tiny growth on your finger somewhere, a little tiny wart, again, they usually go away on your own. Planter's wart, these are usually a little more deep into the tissue, and you're stepping on them all the time, so they're usually more painful. Genital warts is the most common STD here in the United States, yay. And again, you've got little inconspicuous bumps. They can be branching, they can be spreading, they can be large cauliflower-like masses. And I'm like, but they're unsightly in the genital area. But altogether, I'm like, there's lots of different human papilloma viruses. They cause warts. However, we do have 9 strains that increase the risk for developing some type of reproductive cancer. So most warts are not going to cause cancer. We have warts warts all over. My kids have had plantar warts, and I'm like, but there are some strains that can develop into reproductive cancer. And so they're always doing early detection, looking for any abnormal cells. So a normal cell, abnormal grouping of cells. So they do the pap smears to screen for any of those abnormal cells. Luckily, this is a virus that can cause a cancer, but it's a virus we've now developed a vaccine against. So we're vaccinating against cancers. So there are 3 effective HPV vaccines that are out there. The Cervarix, Gardasil, and Gardasil 9. Now, again, back in my day, they didn't have any of these, so you just had to risk it. Although I'm like, I heard that some of these new HPV vaccines, they're even giving to older adults. Now, one of the most common cancers that comes from HPV is cervical cancer. Yet, however, I hear, but so why do boys have to get it? Well, it's not the only cancer that it can cause. It can cause lots of other types of cancers. It can cause prostate cancers in males. And so, although it is the top cause of cervical cancer, it can cause lots of other cancers near the reproductive area. And so we vaccinate both boys and girls. Now, the polyoma viruses, these are viruses that we talk about them with the papilloma viruses. They usually induce tumors. So kind of like a wart, but they induce tumors in animals. The BC or the JC and BX viruses are the ones that are most likely to infect humans, but most are just asymptomatic. You might have a mild symptom. It might cause complications in kidneys with renal transplants. Pretty rare virus, and rare meaning rare to develop any kind of abnormal symptoms. Otherwise, most asymptomatic. Now, onto our last group of double-stranded DNA, and it's in our Adenoviridae group. So it's our adenoviruses. Now, there are 30 types of adenoviruses, all associated with human disease. They infect the lymphatic tissue, the respiratory tissue, your intestinal tract, your eyes. It's spread by respiratory droplets. It's spread by secretions from your eyes. And these strains can cause common colds, but they are not the only things that can cause a common cold. We're going to get to a whole bunch in the next chapter. They can cause pharyngitis, sore throat. They can cause conjunctivitis, pink eye. They can cause keratoconjunctivitis, so a pink eye, usually more inflamed because there's a little bit of hardening of tissue. And they can cause acute hemorrhagic cystitis, where yes, you might have some inflammation of cysts in the body as well. Now, common virus, and again, it can cause usually just the common cold. If you've ever had pink eye with the common cold, it's usually an adenovirus. Now, my little note to know, pink eye caused by a virus, like an adenovirus, or pink eye caused by a bacteria. Because one's treatable, one's not. Pink eye caused by a virus, you're going to have the very pink eye. However, there is not going to be that goopy secretion coming from your eye. You just have a red eye. That means it's not treatable because it's a viral infection. You have a cold. You have an adenovirus cold. However, if you wake up and your eye's goopy and gross and crusty and all that, that's a bacterial pink eye. That you can go get some antibiotic for. Now, we do have a vaccine against some strains of adenoviruses. However, the strains are changing all the time, and there are lots of strains of adenoviruses that right now really the only group that's consistently getting this vaccine are military. So when they are leaving the country, when they're active, they're usually this vaccine. It just decreases how many colds they might get while overseas. Now, onto our next group. This has part D, double-stranded, part single-stranded DNA in its reproductive multiplication phase, and it's the Hepadnaviridae group. Now, it does have that hepad and the hepat in the name, which means it does target the liver. And so it causes hepatitis. Anything with hepat in it means liver. Anything that ends in itis means inflammation. Now, there are lots of things that can cause hepatitis, not just viruses. Alcoholism causes hepatitis. Certain foods and beverages can cause hepatitis. Different other kinds of drugs can cause hepatitis. But we're going to talk about viruses that can cause hepatitis. And now, the hepatitis, when you have inflammation of the liver, is usually going to have some issue with bile pigments and bilirubin accumulating in the blood. And when you have that bilirubin in your blood, it causes a visible characteristic called jaundice. It's when your skin, and especially your eyes, start to have a yellowish tinge to it. Now, there are lots of viruses, 5 main viruses that cause hepatitis. Only one of them has DNA as its genetic material. And so that's going to be the one we talk about in this chapter. That means the other 4, A, C, E, and D, all have RNA as their genetic material. So there's an A, B, C, D, and E. Only hepatitis B has DNA as its virus, or as its genetic material. So hepatitis B, it multiplies exclusively in the liver. It's attracted to the liver, causes issues in the liver, and as it's reproducing in there, it is constantly putting viruses in the blood. Now, it's transmitted by any kind of blood transfusion. Even the tiniest amounts of blood transfusions, needle sticks, anything can transmit this particular virus. So blood products are at the highest infectious rate. It can be sexually transmitted, and so usually the highest cases that we see of hepatitis B is among high-risk homosexuals, meaning they're not using condoms or safe sex, and drug addicts that are using needles. Now, because it can damage and cause inflammation of the liver, any kind of inflammation or damage to any organ always puts you at a higher risk of developing cancer later on in life. It doesn't mean it's a for sure, but it puts you at a higher risk of liver cancer. Now, when it gets in the body, whether through that break in the skin, needle stick, it can get past the mucous membrane, it's usually about 7 weeks before you even start to see the first symptoms. Now, some of the first symptoms that might clue you off that something's going on is that malaise, that tired, fever, chills, anorexia, abdominal discomfort, your stomach isn't feeling right, diarrhea, fever, might lead into that jaundice. You've got that yellowing, a body rash, arthritis in some of these more severe cases. So a lot of different symptoms that can come from with it. And again, part of that's immune system response, part of that's damage to the liver. And some do develop a chronic liver disease where that liver is so damaged it becomes necrotic or cirrhotic. So this is just usually your liver is becoming enlarged. It's inflamed, a rash, a fever, a low white blood cell count, arthritis, pain and tenderness in your abdomen, and some of that jaundice, the yellowing of the skin and the eyes. Now, diagnosing it, there are some antibody tests that we can do. Otherwise, a lot of times they're looking for what's known as Dane particles. It's a very unique shape to this virus that they're looking for. Treating it, well, most treatment is just treating the symptoms with supportive care. And I'm like making sure if you've got a fever, take something for the fever. If you're inflamed, take something for inflammation. Chronic infections might be treated with an interferon to stop the spreading of the virus. But the best bet is just not get it in the first place. It is a virus that we do have a vaccine against. It's 3 doses with the boosters. But otherwise, if you don't get vaccinated, abstinence and monogamy to stop the spread, and universal precautions, making sure you've got PPE, making sure the needles have the covered needle protectors on them so you're not accidentally poking with a contaminated needle. Now, on to our last group of DNA viruses, and it's one tiny little virus group. It's the Parvoviridae group, and of all the Parvoviridae viruses, there's only one that infects humans that causes issues. But this virus has a single-stranded DNA, so that's a unique structure for it. So our parvoviruses, now, there are a lot of parvoviruses out there. Most of them affect animals. So it causes a lot of your cat and dog distemper, is a parvovirus. So there's lots of animal pet viruses out there. So there's only a few that infect humans, and really the only one that you probably will ever run into in your medical career is one known as B19. It causes a condition known as erythema infectiosum. Eryther means red, and so it's going to cause a red rash. It's also nicknamed the fifth disease. Before we had internet, before we had WebMD, doctors had to have lists for everything. They couldn't just Google it. And so they had to have lists of everything, and there was a list of the top causes of childhood rashes, and this was number 5 on the list. So it was also nicknamed the fifth disease. So it causes a rash, generally just in kids. Now, they might also have a fever, but this causes a rash that usually shows up in the cheeks. So it even has a more unfortunate nickname of the slapped cheek syndrome, because the cheeks can get very, very pink and very, very red. Now, those that are immunodeficient can have more serious side effects because the virus can destroy red blood cells. Very rare. That's only for the most highly immunodeficient. And if pregnant women have it, it can transmit the virus to the fetus, which, because again, it can destroy red blood cells, can actually cause a fatal anemia in pregnant women for that fetus, just for the fetus. So again, it's a pretty common virus out there. Pretty rare that it causes any big issues, because even if you're pregnant and pick it up, it's still not that common that would cause fatal anemia. But there are cases out there. My last concept check. A patient complains of feeling tired and achy. You notice a pale rash on the patient's chest and a yellowish skin tone. What is the likely infectious agent? Well, hopefully that yellowish skin tone was your big clue that it's going to be a hepatitis virus. And the only one we talk about in this PowerPoint is hepatitis B. So if you have any questions on DNA viruses, again, send me an email. Let me know if you have any questions.